Hi, it's Michael Moulton from Epiclinic coming to you and talking today about when Fraxel's not enough. So last time we talked about Fraxel, and if you missed that video, subscribe to Epiclinic YouTube channel and check it out. We talked about how Fraxel can do a really good job, but for some people it's just not enough. We live in a society, most of us, so every second that you're out there in the sun, can't emphasise enough sunscreen, 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 sunscreen. Okay, especially if you're fair-skinned, but even if you're not, it's a very, very important thing. So what a lot of people don't know is that if you're driving north to south and south to north, you know, morning and afternoon, in the winter and the autumn and the spring, when the sun is lower in the sky, the sun strikes the side of the face, straight through the car window. So it's those times, we think it's pretty safe not to wear sunscreen during those times. It's exactly when you should be wearing sunscreens. When we see patients like that have got a lot, so much sun damage, the Fraxel's just not going to cut that. So we turn to what I call an all or nothing device. The Fraxel's 5 treatments over 5 months, one treatment a month. And it's a sort of progressive series of treatments, so you get that exponential improvement. Now, what we're going to talk about now though is the Acupulse laser, which is a much more powerful laser than the Fraxel, and that's what we need when we've got these really severely sun-damaged patients with that sort of, what we call a Fitzpatrick 1-2. What that means is they have fair skin, light eyes, they don't have any protection or much protection from the sunlight because they don't have much melanin in the skin, and that's the thing that absorbs all your free radicals. Stops it getting into the elastic layer and breaking it down and becoming all floppy and so on. So when we have patients like that, we turn to the Acupulse, and I say to patients, what you've got to be prepared for with this is going to give you a really good outcome, but you're going to be 3, maybe 5 days, certainly 3 days, where you look like you've been on a fire. But I have to tell you that once that's all healed, by the end of that week, it's starting to look really fantastic. And the reason that you can do these really quite aggressive things to the face is that the face has a unique healing quality about it compared to the rest of the body. You couldn't use these sorts of approaches to, certainly not to the chest or to the neck or to the back. The skin is totally different. The Acupulse is the way to go if you've got really severely sun damage. And you know, you see some people with this sun damage and they look worse around the mouth. They look like they've got a sort of cobblestone effect around the mouth, different to the rest of the skin of the face. That's a sort of patient that's going to do really, really well with the Acupulse. Side effects and complications with these sorts of things. Well, we talked about what the recovery time's like. Complications, you know, you worry about things like infection and all these sorts of things, but they very, very rarely occur. In 20 years of using these sorts of devices, I might have seen 2 or 3 of those sorts of things, and they clear up really quickly with antibiotics. But that's why they need to be in, you know, people like ourselves' hands, should they ever occur. And they're really, really, really rare. Anyway, that's the story on the Acupulse. I hope you've enjoyed that. I hope that that's given you a bit more information about these sorts of things and where you might fit into the scale of things. But don't forget to subscribe. Thanks very much for watching.